I am a urologist. Experience with prostate hyperplasia, and I have treated tens of thousands with benign prostatic hyperplasia. What can you do to reduce the size of your prostate? And then give you an important warning before starting. Well, benign prostatic hyperplasia. What happens to all men? Unfortunately, from the age of 40. Everyone but I'm 46. At 40 years old, 40% men. 50% at 50, 60% at 60 associated 80% at 80, therefore it is super common. Benign prostatic hyperplasia sometimes is not always that way, but it is usually associated with prostate growth. And that prostate growth, what it does is catch and the exit of urine to the exit of the bladder, and it produces symptoms. So many men assume that a large prostate is due to hyperplasia. We will improve the symptoms, and many times that is so to reduce the size of the prostate. First of all, we know to stay slim. Low lean mass, that is having more muscle mass than fat mass, makes the prostate healthier and function better. But the problem with this doesn't work fast. That is no matter how much physical exercise I do today. But we do know that in the long term, men who are thinner and also less prostate cancer, more muscular, they will have fewer problems with prostate hyperplasia and less aggressive prostate cancer. The second of my tips, it has to do with sexual frequency. And this is a highly searched topic. People care a lot. It's a question you ask me a lot. My patients do a lot to me. It's a difficult answer. What they say, not necessarily just the larger prostate, but also more prostate problems. And especially men who have a lot of sexual relations, who masturbate compulsively. So what is the middle ground? Between 2 and 3 ejaculations per week is a reasonable amount to have prostate in good condition and avoid the problems caused by excesses, both by excess and by defect. The third of the things I wanted to explain to you, they are natural products, which is something you may have seen on the internet. And my comment regarding this, it is something different to reduce the symptom, agree in my opinion. Based on everything I see posted, and there you can enter pub.doctors, which is the place where doctors hang all hospitals. We posted our investigation, the natural extract, or natural product that has more efficiency when it comes to reducing prostate symptoms, and in some studies. But it's not something that works particularly well. This product for reduction is the H3-enolrapins. It's a medicine which has been shown to reduce symptoms, not so much the size of the prostate. Agree many other natural products that come from traditional medicine, and there are a lot. The pumpkin pipes aid the nettle in each geographic area. There are specific products. What you will see that there are some of them that have some studies that support them, but they will also have studies that prove they don't work. And in many of overall, it doesn't seem that these products help, especially to reduce the size of the prostate nor the symptoms. In my opinion, we think someone else. It also seems debatable to me. But Chirano, without a doubt, the one that works best day. The fourth of the strategies to reduce prostate size. They are things. What do hospitals have to do with doctors? Finasteride and dutasteride. What they do is block the passage of testosterone, and that causes the prostate to shrink by around 40%. And in my opinion, for the treatment of alopecia, in that patient substrate, but older patients, they seem effective and safe. Medications reduce prostate volume by around 40% and save 50% of surgeries, pretty much the safe way. It is with surgery, but logically we must try to avoid. Get to that point with these three tips that I gave you at the beginning. And here comes the warning. There are multiple causes for prostate hyperplasia. Many of them we still don't know. Some of them are genetic. There are families of men who all have a prostate. Very big, have a big prostate. That does not necessarily mean having problems. Have a large prostate. In fact, we know that it is not related to the presence of prostate cancer. But if you have a very large prostate and you have many symptoms, it is unlikely that any herbal extract be powerful enough to improve them or to reduce the size of the prostate. Well, we urologists wouldn't operate. Or so many men who have hyperplasia, let's say large prostate. Conservative, how to reduce the prostate when the problem is starting. It seems very appropriate to me. Some natural products can help you have a healthy and orderly sex life. Let's say, they seem like a good idea. When you pass a certain point, simply the natural, the non-invasive, it stops working and then you have to go to the doctor to study your case. See if you need medication, if you eventually need surgery. I hope the video has been useful to you. Remind you that we are also on TikTok, 10 p.m. Spanish time. Okay, I just hope to see you soon. Greetings.